Joining us now is Dr. Michael Saag, Associate Dean for Global Health at the University of Alabama at Birmingham. And Dr. Saag, you just heard Kristin rolling through some of the numbers we're seeing there across a lot of different states showing some big spikes in cases. What's your take on necessarily how now where options are pretty much limited in terms of what we can do to kind of stop what we're seeing already start spreading across the country yet again?
Yeah, I'm afraid that the status quo is not going to cut it for this point forward, at least for the next 8 weeks. So we're going to probably have to do something different. It's interesting to me as I listened to the data just now, how the tables turned. Back in April, people were saying, well, we can't let people from New York come to the South. Well, now New York is saying we can't let people from the South come on up to the North. So I think what's happening is that all the southern states and some others basically became Missouri. They're the show me state. They didn't believe that this was real. Well, guess what? It's very real. So we've got to buckle down and take care of ourselves, or else we might see another doubling of the cases up to 100,000, as Dr. Fauci said.
Yeah, and that's the number that's kind of maybe making people realize that this is here and it's a problem and not going in the direction that a lot of people wanted it to see go. But when you think about that 100,000 case a day estimate, it's in July right now. This is really the time that people were thinking we would be able to get a handle on this before the fall season and winter season when you have flu to worry about as well. Based on the trajectory we're on now, what do you make of the way that preventing the worst case scenario here in the winter seems harder and harder to really imagine?
Yeah, we've got a window of opportunity to act right now. What I've been saying is all of us should imagine that we're 80-year-old people who have underlying conditions and ask the question, what would we do if we were 80 years old? We'd stay at home, we'd avoid large crowds, we'd wear a mask everywhere we go, and we'd avoid any location that other people are not wearing masks. We can start there. All of us want to avoid another shelter-at-home environment, but if we don't get this right, we're headed that way. And the reason is not just the number of cases. What I'm most concerned about immediately is the overwhelming of our healthcare systems. Hospitals are starting to fill up here in the South. I think Texas in particular is under siege right now, but they're not alone. All of us are worried about that, and that's the nightmare scenario, that there's not going to be any room at the end, and patients won't be able to get in with or without COVID.
Dr. Saag, it's Kristin here. I want you to react to something that came out of Texas. Lieutenant Governor Dan Patrick there saying quite literally, actually I'll quote him here, he said, "I don't need his advice anymore," when referring to Dr. Fauci and some of his comments about the rising case count number. I mean, as a doctor, as someone who knows public health, how concerned are you when you hear officials in the government saying that they don't need to listen to the leading experts on this disease anymore?
It's concerning for obvious reasons. I think everybody listening would sort of recoil at a statement like that. But here's our problem, and I think this is why the United States right now is out of step with almost every other industrialized country, and that is we are a divided nation. We have become so polarized that even wearing a mask has become a political statement for some. If you're wearing one, other people say you're anti-Trump. If you're not wearing one, you're pro-Trump. We got to go beyond that. We're in this together. I grew up in Kentucky. The motto was, united we stand, divided we fall. Well, we're very divided now, and we've got to come together. Experts like Fauci have been at this for over 45 years. I think he knows something about this. We should listen.
Yeah, and when we talk about listening to him, he has given the timeline here on the vaccine front. He seems pretty steadfast in hoping that we could see a vaccine by the end of the year. We got an update there on that front from PFIZER today, announcing a little bit of the preliminary data out of its trial on the vaccine front. Optimistic, after 28 days, all participants in the lower dose groups there showed significant binding antibodies, according to that company. But the FDA yesterday gave the guidance that it wouldn't approve a vaccine unless it shows to be at least 50% effective, more effective than a placebo. So what's your thinking around maybe that guideline the FDA set up there and what it could mean for the vaccine front and whether or not we will still meet that 2020 end of year into 2021 timeline?
Yeah, well, I think it's important on this particular topic to dig into the weeds, so bear with me. This particular vaccine, like several others that are being developed, are RNA vaccines. They take genetic material from the virus that codes for that outer coat, where the business end, where that virus binds to a receptor. And what that particle does is it stimulates an immune response that the antibodies produced by the vaccine bind against the virus in case it was to be encountered and prevent it from infecting a cell. What they discovered, and they announced this week, in fact, just a few minutes ago, was that these antibodies are produced at very high levels. In fact, the levels they're getting are even higher than someone like myself who's been infected. They're getting titers higher than that. The question, does it protect? Won't know until the large study's done. We also don't know if we do get protection, at least for the short term, will it be long lasting? No clue. The 50% is a low number, in my opinion. I think we need to see 70% protection for this really to make a difference.
Dr. Saag, I want to ask you about the move that New York is making, which I'm sure reminds some people about what Europe decided to do, with each individual country essentially saying, we're shutting down our borders. No one is allowed in here until you get a handle on your virus, and so allow us to get a handle on ours. Do you at all think that that might be a solution in the United States for each individual state to say, listen, we are not allowing people from other states to come here. You need to fix your problem over there, and we will try to contain it here.
There's an old adage in infectious disease that a virus isn't gone anywhere until it's eliminated everywhere. So we have to pull together. I don't know that it's going to be productive to put fences around the borders of states. That's not going to get us anywhere. Why don't we direct our attention on all of us working together to have everybody wear a mask, stay at home, at least for the time being. Sorry, I know it's not fun. I'm tired of it too, but this is getting out of control. And I think if we approach it together rather than pulling apart even further, I think we have a better shot at getting this under control.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.